My name is Deborah Berger. I'm one of the presidents of the California Nurses Association National Nurses Organizing Committee, and I have with me
Sal Roselli, the president of the National Union of Healthcare Workers.
So today we're announcing the affiliation of the 10,000 members of National Union of Healthcare Workers with California's biggest representative of registered nurses, the California Nurses Association, which represents 85,000 RNs and other professionals in California and is a founding member of the 185,000 member National Nurses United. Would you like to say something?
No, why don't you go ahead?
Okay. So this is a significant affiliation that should send an unmistakable message to California's hospital industry. California's RNs, now joined by other healthcare hospital workers, will not accept the outrageous and unwarranted attacks on patient care protections and on our own contract standards, working conditions, and our livelihood. Go ahead.
CNA and NUHW, an affiliation whose time has come. You go ahead and finish. No,
Okay.
All right. You can tell that this is a new relationship that's being born here.
It's actually a reincarnation because we've been working together for decades. What I would like to do is acknowledge my co-president, Zenny Cortez, and Martha Kuhl, who would also like to treasurer of CNA. And so, oh, yes.
I wanted to give some context to this for folks. CNA is like the oldest union of registered nurses in the country, and our predecessor union, SEIU Local 250 here in California, was the first union of healthcare workers. And, in the 70s and most of the 80s, our organizations were very different, under different leadership. In fact, I remember as an organizer, we were not allowed to talk to the staff of the CNA or the nurses of the CNA. Well, in the late 80s, that began to change, and it was because of new leadership in our organizations. And I'm reminded, this moment here is reminding me of 1992. Where a corporation, the corporatization of healthcare was going on. The corporation took over 3 of our community hospitals here in Oakland, right down the street from here, and formed an organization called Summit. And they bargained with the CNA and with SEIU Local 250 at that time, and some other unions, and took care of all the economics and the other provisions and the contracts that we had long established, except for one issue. And that was the issue to respect each other's picket lines, to be able to support each other union's goals, right? They refused to recognize that. And we met with the workers, vivid memories of us sitting in the cafeteria and going to the hospital and talking to people together. And just put it to workers, right, what it would mean if we couldn't support each other. They're trying to divide us. And the workers decided to strike over that issue. It was unprecedented. It was a very long and hard strike, almost 2 months. I remember us being criticized inside SEIU for taking workers out on strike over this issue. And the ANA at that time, which was over the CNA, right, the National Club of Nurse Managers, right, were very critical of us doing this strike. And it's because there was a fundamental difference in ideology, where the leadership of the CNA and Local 250 at that time believe that it's fundamentally important to empower healthcare workers, right, to stand up for themselves and their patients. A fundamental difference in ideology. And the strike got national attention, not only because of the issue, but because then presidential candidate Bill Clinton and Jerry Brown came to our picket line, and Jesse Jackson came to the picket line. It was an extraordinary event, and we collectively won that strike. And I'm reminded of that today because I feel like we're in the same place. In the 90s and the first decade of this century, we worked very closely with the CNA and registered nurses throughout this state and helped improve the standards for healthcare workers, defined benefit pensions, full family coverage, and perhaps most importantly, a real voice in determining staffing levels, right? To protect patients, to determine how care is given. In 2009, we had some disagreements with our international union, who was progressing top-down deals with employers to trade these standards, in exchange for growth in other places with these employers. Leaders in our union stood up to them, and it resulted in a hostile takeover of SEIU UHW in 2009, and that was the birth of the National Union of Healthcare Workers. Over the last 4 years, that collaboration that we had with the CNA to improve standards for workers and protections for patients has been turned upside down on its head. And every contract that SEIU UHW, led by Dave Regan, that they bargained in the last 4 years with every healthcare employer in the state have resulted in huge takeaways for workers and patients. Elimination of defined benefit pension plan, elimination of family health coverage, elimination of a voice, disempowering healthcare workers to stand up to their employers through their formal partnerships like they have with Kaiser Permanente and Sutter Health and virtually everyone else. And this is all happening in a time where the nonprofit healthcare industry is more profitable than ever. Kaiser Permanente, $6 billion in profits in the last several years while demanding bigger and bigger takeaways. So we're just here to say that this is an affiliation whose time has come. It's time for us to join together and to reverse that trend that Dave Regan and SEIU UHW has established here, to win back the standards for healthcare workers and our patients, and then to give the 9 million hospital workers across this country an opportunity to join this movement. So we're very proud to be here. Thank you.
Zenny, would you like to come up, please? Thank you.
Good morning. My name is Zenny Cortez. I'm a 31-year RN. I work for Kaiser Permanente. I'm one of the co-presidents of the California Nurses Association and also the chair of the Joint Area Bargaining Council for the Kaiser Division. I'm very happy and very delighted to announce our formal relationship with NUHW. We are joining forces to fight the biggest corporation there is here in Northern California, and that is Kaiser Permanente. We need to put a stop to Kaiser's cuts in mental health and also to fight back every concession that has been put forward by Dave Regan and his cronies, his managers that run SEIU. It is disheartening to say that it has undermined our fight, and so joining forces with NUHW would be stronger front, and that we will fight every step of the way to protect our patients and to protect every gain that we have. A few months ago, for all of you who do not know, Dave Regan put forward a proposal to roll back the hard-fought ratios that we fought for 10 years. And who would do that? It's unconscionable, and I think it's very, very destructive, first of all, for the patients that we care for, and also for the workers, the frontline workers that have been there, protecting patients and when they're at their most vulnerable state. So today I'm very delighted that we are with NUHW and we can join forces again, like I said, to fight back every concession and every cutback that Kaiser would be proposing. And so I'm very happy that we're there, we'll be out in the open, and nothing would be a secret now. So with all of the RNs and the other healthcare workers, we can do it and we can make it happen. Thank you.
Martha Kuhl is the treasurer of the California Nurses Association. She also works at Children's Hospital here in Oakland.
Hi, everyone. For those of you who know me, you've known that for years I've worked alongside my coworkers at Children's in Oakland for over 30 years. And one thing I know as a registered nurse is that I am not able to give the highest quality of patient care without working with my coworkers. Without the ancillary workers in the many different roles, we cannot do good patient care. And one of the hardest things has been for us when SEIU UHW, Regan in particular, has attempted to undermine and roll back the standards for the workers that they represent. It makes it harder for us to give good patient care. And it's really unfortunate that in these economic times, our employers, large and small, and independent like Children's, to the biggest like Kaiser and Sutter, they are attempting to roll back standards to before I was a nurse. And now, I've been at the bedside for a long time, and they are attempting to take us back. And I, with many people in this room, struggled every day on my job to make our lives better, to make our patient care better, and we can't stand for this. So we are looking so forward to working collegially with NUHW on this, and we abhor the fact that Reagan's sign has been praised by the California Hospital Association in his rollbacks. Thanks.
Also, like Sal Roselli gave us a little bit of historical perspective on the relationship with CNA and our ability to fight back. But what we have left out up to this point is a few important facts that I think are really relevant to why nurses are getting into this fight with NUHW and why we've decided that the affiliation has, time has come. And that is the fact that there's this manufactured pretext for the cuts in both patient care services, in rollbacks at Kaiser and services in mental health and other services, and even other hospital chains, when in fact the hospital industry in 2010 alone made over $4 billion in profits. They collected more than $1.8 billion in government subsidies and benefits from their tax exemption status beyond what they provided in actual charity care. And they handed out over $1 million in pay packages per executive to the top 100 wealthy executives, all the while trying to undermine our patient care, undermine nursing practice, and undermine the benefits of workers that provide the care that enable them to make those huge profits. So we want to make sure we have allies that will stand with us instead of going and testifying on behalf of the employer and testifying in the legislature and cutting deals with the employer at the detriment of our coworkers. So we're proud to stand up with NUHW to make sure that we have their back, and as long as they're fighting for their workers, we'll be there fighting alongside them, because we know that it takes a team to provide good patient care, and we will always be there to make sure that our patients are taken care of, that our communities are taken care of. So I'd like to
Gloria and Ken have a...
Gloria and Ken? Or both?
Gloria's
Go ahead.
My name is Gloria Villasenor. I'm a rank and file optical worker with NUHW. I work for Kaiser. And for those of you spelling it out, Villasenor is Villasenor. And I'm really happy to be here today. Back in 2009, along with 4,000 of my coworkers, I decided to join NUHW. And I've been proud ever since. We've been a union that fights. We're member driven. I'm happy to say that our members overwhelmingly voted for this affiliation. And I've been lucky enough to be with 2 historic strikes with CNA nurses, and I can tell you, as much as the leaders of our unions thought that this was a great idea, so do the workers. Being on those picket lines, talking with them, we know that we have to stand together to fight for patient care and fight for the rights of the workers. At a time when Kaiser's making historic profits, we think it's only right to hold the standards, and I'm excited for all the workers in California. I think this is a great moment. And when we left SEIU, it was a time when workers were no longer being represented. And I'm proud to say with NUHW, we represent workers, Kaiser workers with SEIU, 1,000 of them have gotten layoff notices. Not one of those workers was an NUHW worker, because Kaiser knows we stand up for workers' rights, and we're willing to do what we have to, and to stand united together to fight for our rights. And right now we're at another historic opportunity where the 43,000 Kaiser workers that are still in SEIU have a chance to join NUHW. And we were very optimistic about it, and I think joining with the nurses, I think we're going to be, I'm pretty confident we're going to be able to do that, take back the Kaiser workers and take on all the other hospitals in California. So I know that CNA and NUHW is the same kind of union. We're a fighting union. We're going to stand up not just for worker rights, but for patient rights. And I think that a lot of good things are coming, and I think 2013 will be a year of renewed strength and determination for the workers. And I can't wait to get started. Thanks a lot, you guys.
My name is Ken Rogers. Ken Rogers, R-O-G-E-R-S. I'm a contract. No, people put in a D there. You'd be surprised. Slipping it in. I'm a contract specialist with NUHW. Been a contract specialist for the past year. I'm a steward, shop steward with the Integrated Behavioral Health Services, part of NUHW. It's the psychologists, social workers, chemical dependency counselors in Northern California. We are a part of the 4,000 Kaiser employees who are proud members of NUHW. I'm also somebody who is working with the Regional Bargaining Committee to negotiate contracts with management over our latest contract that we're trying to bargain with them. And so I can tell you firsthand that there are some considerable challenges in working with this group, this management group that we're now faced. There seems to be what I would describe as a new narrative, which is that the need for cutbacks, the need for more money into the system is not based on some sort of real need, but it's really based on increased profitability. That you come to this table with profitability, you come to us and you say you want more cuts. What you're telling me, whether you say it directly or not, is we want even more money. And this is our direction, and this is our choices, and this is our priorities. Well, with NUHW and IBHS, I can tell you that our priorities have been patient care, our priorities have been member rights, our priorities have been having an equitable workplace, something that we can work with, a system that we can work with our managers to have local control over decisions that are being made. And this is something that we're really proud to now formally be a part of an alliance with CNA around. As Gloria mentioned, CNA has stood with us already twice in strike actions. We were very proud to have them there, and we're very proud to move forward with them. And we look forward to their continued assistance, and really each of our continued alliance as we go forward. Thank you.
Have any, we'd be happy to make up answers.
Hi. I was talking to SEIU, and they weren't really positive about this affiliation in terms of how it was phrased was that, basically you're trying to get something from Kaiser that the employees are not giving. which is increasing the NUHW membership, and for CNA, they were saying, well, gee, they can't even get a contract with Sutter. Could you both respond to that?
Well, there's a number of answers that I could give you on that. The reality is that with Dave Regan agreeing with the employer and working with the employer to take concessions and then say, me too, and let nurses be out on the line for over a year and a half, 2 years, fighting those same contract standards instead of being out there with the nurses is disgraceful. So what we want to make sure is that we have affiliates and people that we work with and trust that will fight the employer and know that they're going to stand up for patient care. Nurses have been out on the line for a year and a half, 2 years, some 5 years, fighting their employer, like Sutter, one of the worst employers in the state when it comes to cutting services, cutting mental health, cutting benefits at a time when they're making outrageous profits. So I'd let you draw your own conclusion on how you think that would work for you as a patient.
Maybe you explain me too.
And I would add that, SEIU has bargained contracts with the Sutter Corporation and Kaiser Permanente and every one of their competitors in California. That has included huge takeaways, elimination of defined benefit pensions, and Kaiser recently, loss of retiree health care benefits, loss of voice in determining how care is given, loss of employment security. In Sutter Health, health plan takeaways, employment security takeaways, pension takeaways. They're the contracts that Dave Regan and SEIU UHW has bargained for SEIU members in California. SEIU is right about one thing. The CNA and NUHW will not bargain those same contracts because the workers are not going to accept those takeaways for them and their patients. NUHW members that work for Kaiser Permanente have not lost a single one of these benefits or voice in these last 2 years of bargaining. We don't have a new contract yet, but we still maintain every one of those conditions that SEIU members have lost. And united with the CNA, it's our intention to maintain those standards and to continue to empower workers to have a real say in how patient care is given.
And I should clarify the Me Too. When Dave Regan and UHW settled a number of their contracts, they left it up to the nurses to do the fighting because essentially they agreed to the takeaways. But if any other union managed to fight those takeaways and get them off the table and get benefit increases or enhanced benefits, they would get those benefits back. So they're letting other people do their fighting for them instead of standing up together and fighting it as one group and letting the employer off the hook and essentially doing the employer's work.
In fact, Joyce, here's a real quick example of this just playing itself out. In San Francisco, California Pacific Medical Center, Sutter Corporation, the most profitable hospital in the country, perhaps. The CNA and NUHW represent workers at the Children's CPMC campus, St. Luke's and the CNA, the SEIU and the CNA represent the workers at the St. Luke's campus. We've been fighting for a contract there for a number of years, right, for the workers. They settled the contract at St. Luke's with huge takeaways in benefits and voice, with a Me Too to both the CNA and NUHW. If either of our two unions in the same hospital system accomplish anything else, they'll get it. That's who the SEIU is under Dave Regan's leadership in UHW here in California.
Yes.
Steve Early from Labor Notes. Several of the speakers have mentioned the layoff notices that 1,000 Kaiser workers have received. And I understand that at least one of the partnership unions, AFSCME, has temporarily suspended its participation in partnership activity in protest of this breach of the job security language in the Kaiser contract. Do you think that there's any possibility that other AFL-CIO or Change to Win unions that have previously followed the lead of SEIU and the partnership coalition will now split away and possibly join the anti-partnership coalition being unveiled today?
Of AFSCME and UNAC was that they're suspending activities. They did not say that they were pulling out of the partnership or that it wasn't a good idea. CNA has historically said that we would never join an employer union partnership agreement because it is a direct conflict of interest for us in representing our patients and then trying to pretend that we're in partnership with the employer. We are in a partnership with our patients, and that's what comes first. That's what directs that's what directs everything that CNA does. That's what directs everything that we do at work, and we would never sign a partnership. For them to say that they're suspending activities means that they're not going to the parties, they're not going to the little committees that they have no real voice in, but they're still paying their dues to those partnerships. So they're essentially paying to be chattel for the employers.
You know, Steve, you're right. You know, they're having, and the steel workers and the inland empire are having demonstrations. Well, all of their workers are being forced to take the same takeaways, you know, in reduction in voice that Dave Regan and SEIU are leaving. So I think instead of suspending partnership activity, they should notify Kaiser that they're getting out of the partnership and they should join us in this campaign against Kaiser and the workers.
We have never abandoned going forward for single payer. We have always been working on that. It's never been on the back burner for us. That is a priority for our organization, and it's a priority nationally. In case you don't know, we have the campaign for the Robin Hood tax so that we can actually pay for Medicare for all, improve Social Security and education. So we absolutely are always making sure that that's going to be something that's always on our agenda, and it's always the first thing that we think about, and it's what we always are talking about. With us joining with NUHW, we're going to make sure that that is a priority in California. As to working and winning an election, that comes first. So we're going to have more than enough work to make sure that we win an election for our coworkers and make sure that they have a voice in the workplace. So,
you know, our leadership and our predecessor union has been working with the CNA since the early 90s to accomplish Medicare for all here in California and across the country, and it's the only real solution to access to quality health care for people in America. So we'll continue to do that, certainly. When we win this election, this Kaiser election, it'll be a game changer. The Kaiser contract is the foundation of SEIU healthcare. And once those workers are free and we win a good contract with Kaiser, it'll open up all kinds of doors for both SEIU healthcare workers with other employers and non-union healthcare workers, which are the supermajority in this country, let's be clear. Most healthcare workers are unorganized, to give them an opportunity to join our movement. And I'll just say, this is like the first pure union, national union of healthcare workers ever, right? And many of us in this room have had a career-long vision of uniting healthcare workers across this country into one union, and now we're going to accomplish that.
Good. Sounds
Work and what that actually means. Joint negotiations, just if you could detail that a bit more.
Sure, it's a legal affiliation, a legal partnership, right, to join together to accomplish our common goals, which we've been talking about here today. The unions will remain separate in terms of constitutions and bylaws and governance, but we will act like one union when it comes to fighting employers like Kaiser Permanente and Sutter Health, and when it comes to organizing hospital workers in unorganized places. And when we deal with government, you know, government regulates and funds healthcare, we'll join our power and act like one union when it comes to dealing with government also.
What about about the affiliation with machinists, or I'm not sure if affiliation was the arrangement that NUHW had with machinists? Is that still friendly, or what?
Well, we're very friendly. We over the last year, we've made a lot of best friends in the IAM here on the West Coast, and we'll continue to work with them together on common goals in Sacramento and Washington, D.C., and fully expect them to help us with this big election that's coming up. So we've made a lot of new friends, but the affiliation discussion is not happening with the IAM. We're affiliating with the CNA.
Do you have any idea of when the election is likely to take place? And have you had any discussions about what kind of resources you'll be able to pool into that fight?
It'll probably be sometime this spring. The NLRB is not the most predictable organization in the world, but we imagine within the next few months, sometime this spring. And like we've said earlier, our organizations are going to act like one union. This will be one campaign, right, to win together. And both of our organizations are going to prioritize making it the #1 activity, right, for all of our staff and members.
And you should be aware that the nurses within the Kaiser system are extremely dedicated to make sure that this election is successful. And we're going to make sure that nurses understand that the reason that we are working with NUHW is so that we can defend the standards of care at all Kaiser hospitals.
One last question. Do you think in the last election, Kaiser was charged with collusion with the SEIU and interfering in the democratic election process? Do you think that this is going to happen again, where they try to coerce people using management to do something like that?
They're not going to do it openly, and they're not going to send out a memo, but I can see it. I can see it. I work at Kaiser. I'm a Kaiser nurse. I work at Kaiser in Santa Rosa, and I'm there 3 days a week. And I can see our administrator talking to the SEIU person there all the time, spending more time talking to him than he probably spends talking to anybody else in the hallway, right in the hallway. So I'm pretty sure that there's some cooperation going on, but it's not my job to actually do all the investigating work.
If this election were to be held today, right, and we were not to win today, this election would be thrown out too. Kaiser and SEIU have not stopped or backed down on their collusion, breaking the law, giving SEIU every advantage, just like the last election. It's because the stakes are so huge. Kaiser, in the retiree healthcare takeaway that SEIU just agreed to, Kaiser realized a savings of $800 million right off the bat. Their defined benefit pension, eliminating that, potentially billions of dollars of profit at stake. So you know that Kaiser's going to do anything possible to help SEIU win. SEIU is Kaiser's union, Kaiser's choice. And we're going to, despite those odds, accomplish the opposite and help these members win back their union, these workers win back their union.
Any other questions? No? Okay. Thank you for coming. We appreciate the time you've taken to hear the story right from us. Thank you.
Yes, thank you very much.
Oh, we have a special
nurse, and I've been an RN for over 50 years. I've worked at Kaiser for very many years, and what I'm seeing is that the whole of the industry, the Sutters, the Kaisers, the Catholic healthcare, all of them are wanting to push the nursing back to when I first came out of nursing school back in 1957. We can't allow that to happen. I was very active in taking over CNA so that it would be be for the nurses and would be run by bedside nurses. What we have accomplished in those years is fabulous. I mean, it took a lot of work, but we got ratios for the bedside nurse, which meant better care for the patient. We were able to put in the word advocacy for patients in the Nurse Practice Act so that it is a demand, legal demand, that RNs do advocate for their patients. It's extremely important. What I'm watching is a combined effort to get rid of bedside nurses. And if this SEIU UHW, whatever its name is, I can't pronounce it correctly, I'm sure, is successful, you won't have a nurse at your bedside, will not have the experience, will not have the knowledge to be able to help you. This is so important to us. It really is. Because the goal of this particular group, Mr. Regan, is to destroy ratios, to destroy lift teams, to destroy everything that we have worked for to ensure that the patients would be cared for better. And I'm very worried about it because I've been in the past and I know what it was like, and I don't want to see it to go back there. You know, finally, the RNs are making a decent wage. I retired from bedside nursing in '95. I didn't have a defined benefit. So my Social Security is $660. That tells you how much money I made in my career. I don't want to see that happen again.
Why is Dave Regan and the SEIU making these deals and kind of going along with concession bargaining?
You know, I really don't know. I have a theory, but it's just my theory. It has nothing to do with either organization here, is that I think he probably has a problem with ego and feeling threatened, and therefore he's trying to protect himself by joining the group that has the most ability to get things their way. And you know, I understand that, but I think that it's very detrimental to workers, to his own workers. I mean, this is one of the reasons why, you know, we looked at everything that has happened, all the issues that were talked about, and the Me Too in the language. And it really is, it's sad. You know, if I lose my health care benefit as a retiree, what is that going to mean to me? It means that I maybe have 6 months or 8 months. You know, it's one of those things, and for him to have allowed that to happen to the retirees, you know, yeah, they're not paying dues, so we can get rid of them. That was my take on it.
Do you think the nurses are pretty united on supporting this merger? And
Yeah, I do. I really think the RNs are united, and we need to stay united. Quite frankly, I try to go into all the Kaisers that I can and talk to the nurses, because I am so frightened about what's happening to my profession. You know, I wanted to be a nurse from the time I was 5 years old, so that should give you some idea of how involved I have been.